Welcome back. So for anyone that like can see the mess of the TV. So if you're watching this on YouTube, you're going to see the mess of the TV and be like, what is going on? But I brought a couple things. So we have to induct you with some glasses. We'll get to it in just a second. But one of the things I thought is, so I have this massive vitamin container, right?
You sure do.
So I have 2 others of them at home. But this one I tried to return to Amazon and they were like, okay, here's your money back, but we don't need it. But what I thought I would do.
Don't you just love when that happens?
Yes, because then I don't have to do anything. I pre-filled it with some gummy vitamins for you. Now, these ones, the really good things about these ones is these are the children's ones. So what I love about them is that your children could each take 1, but mommy could take 4, and she would have all her multivitamins for the day.
Really?
Yes.
I am down for gummies.
So you are taking this home because I know you don't eat any of your vitamins.
Oh my God, I love you right now. I'm very happy to be a part of this podcast. Thank you.
saying.
Can I say something about vitamins real quick?
Sure.
So I have this, I ordered multivitamins for my toddler. And because I was reading, like, obviously gummies and all that stuff, they're kind of like picky eaters now at this stage, right? So I didn't want to like introduce any more sugar or like the stuff that's in the vitamins. So it's this company called Ella Nola, and it's powder. Literally, right when she wakes up, whether it's her milk or her water, I dump it all in there. It's flavorless. You don't smell anything. And she just chugs the whole thing. So I know that she's getting her whole vitamin serving. So then I'm like, wait a minute, do they have the adult version of this? Because I have like the worst gag reflex on this planet. And like, I can smell something, it'll make me gag. It's like horrible. So don't ask me how I survived the ER as a nurse. Like, I just don't understand it. I don't gag when I smell like piss and poop, but vitamins, I'm like, can't do it. It's disgusting. So I ordered, they had the adult version of it. So I literally put it on top of my coffee machine now. I think I've had it like 4 days in a row, and I'm really proud of myself.
You're doing it?
And I dump it in my coffee the first thing, like as it's frothing, I just dump it in there and then I just chug the whole thing. It's fantastic. Okay, where is this from? Do we want to say where it's from?
So these are Smarty Pants.
Smarty Pants.
Smarty Pants, that's the company. So this is the children's multivitamins. I tell a lot of women, so it's really interesting with women. So see, they taste really good.
They're very orangey.
Yeah. So, but kids like them. But it's all natural colorings and natural flavors and all that kind of stuff.
And adults have to take 4?
Adults would need to take 4. To get
versus a toddler needs to take 1?
1 to 2.
This is actually really good.
Yeah.
I like it. Thank you.
You're welcome.
Where's my breakfast for today?
Oh, goodness gracious.
I forgot to eat. I was at the drive-thru of Starbucks, and I saw that they have a new protein coffee thing. Have you tried it? Like,
I tried it once. It was really, really good. They have it with the sugar-free vanilla protein powder that you can put it in. Love that it's a whey protein powder. The only problem is they mix it with milk. Because you'll think it's the protein.
Yeah.
But that's a common side effect. A lot of women, women start drinking protein shakes and they'll be really, really gassy. And it's just your body needs time to adjust to it.
oh, I didn't even know that.
Yeah, because it's kind of like pre-digested protein.
Good to know. You would, of course, know that fact.
I know. So we are getting into something fun. I thought that this was something that we needed to do. So if you can see us on YouTube, you're probably like, why do they have, like, as you see, I have glasses here. I have my actual reading glasses. And then I have my, if I wanted to put them on, then I have my readers too. So one of the things that I wanted to do is I was telling Nar about this. We are going to become official members of the We Do Not Care Club. So we're going to explain what this is. So if you guys don't know what we're talking about, we're going to explain it in just a second. So kind of quick bio on what we wanted to do. But because of our podcast and the fact that we talk about women over 40, I knew that when I started seeing this, and then when I ordered the book and I was like, oh my gosh, this is incredible. So I've done a lot with my social media over the last few years. I've started infusing humor into it, just with talking to women and stuff like that, because I found that if not, then we're just going to cry. I was listening back to our podcast where we were talking about, perimenopause. And when I asked you, like, what scares you about perimenopause? And you were talking about losing my energy and losing all these things. And I was like, if we don't have humor in this, it's going to literally scare the shit out of people.
Oh, yeah.
So this little book, so if you can't see us, but this is Melani Sanders, the official We Do Not Care handbook. And so I'm just going to tell you a little bit about it. So Melani Sanders is a content creator and social media influencer. She is from West Palm Beach, Florida. She's the founder of the viral We Do Not Care Club. So after you guys listen to this podcast, finish listening to our podcast, then you can go look at Melani Sanders. But back in May, she went to her gynecologist and she came and she got in her car and she was just fed up. She was so fed up with everything they said. And so she goes on and on and on about we do not care.
Okay.
So we are in perimenopause. And so the book just starts talking about everything that we do not care about, any possible thing that you can do. So in here it says, so we're going to officially join, so we'll fill this out, but we do not care club membership card. So we're going to put this seriously what the 40. The chapter is going to be Los Angeles, and where the member sends today's date. And so it says the above named sister is an official member of the We Do Not Care Club and a global advocate for the We Do Not Care movement. This card certifies that she is perimenopause, menopause, postmenopause, and she simply does not care much anymore. So if our sister's coochie is dry, we all have dry coochie. So as you can tell, it's crass, it's everything.
Best.
There's all kinds of little patches in here. So you have official patches of everything. But I thought some of these were really, really great. As you go back into here, it's the high performance opt-out. I thought this one was hilarious. It's the notification to your partner. It's the sexual opt-out. And it talks about all the reasons. And this was the best thing. For the moment to address your own sexual needs, you may do the following. Read erotica, watch porn, rub one out, have an affair with our hot neighbor, just kidding, self-medicate, clean the garage, hump a tree, take a cold shoulder, call your mother. And then it says, for the moment, please use the guest room, and whatever you do, do not touch the thermostat.
Oh, there you go.
So I thought we would just kind of bring this just so you guys could see. It is a great book for anyone that is really trying to say, you know, what the fuck is happening to my body?
Yeah.
What is going on? And it's just, so it's for the women that I would say are new to perimenopause and going like, what is happening? What is coming? And then the others. So basically, it just says, this club is for all our sisters. Here's a list of things we do not care about today. So this is where you can get the humor of it. Shaving our legs, plucking our chin hair, wearing bras, wearing PJs all day, clothes is clothes, being on time, cancel plans. If you're cold, don't even think about touching the thermostat. I thought we would just kind of go in for a few minutes and kind of talk about different stuff. The reason why we have highlighters, go watch one of her videos. She gets on every time and she says, we do not care about today. And she'll read all the things from everybody around the world that has said in the we do not care. And so she literally has this flip notebook. And she then goes, we do not care about that it's hot outside, or we do not care about the fact that it's winter and I have the thermostat at 65 all the time.
Right.
And then she goes like this and she highlights like every single one of the things. So it is just,
it's great.
I tell women, if you are looking for humor, something to just stop thinking about this, then it's really, really good. And it'll just make you feel better. But what I wanted to then talk about with us is kind of the things that we talk about. So, and I kind of threw Nar on the spot because she's kind of coming into some of this. So I thought it would be even more fun to just kind of do it this way. This club encourages women to let go of unrealistic expectations and perfectionism. And, you know, it uses the humor and relatable lists. So unrealistic expectations, perfectionism, like, what do you have going on? Like, because, I mean, you walked in here and you were like, oh my gosh, I have so much going on. I'm just barely trying to survive. I'm barely trying to keep my head above water. So, like, what are the things that are going on emotionally, physically? Like, you're like, oh my gosh, I gotta let go of some of this stuff because it's killing me.
I think literally right before I came, I actually made it a 2026 goal of mine to get massages more frequently, because I think a little bit of stress in life is fantastic because it drives you to do good. But you also need a moment where you just need to chill out, like relax your mind, relax your body and all that. So, but I'm crazy because during my hour-and-a-half massage this morning, I literally was thinking about everyone else other than myself, like what I have to do, the emails I have to get through. The insurance guy wants our odometer reading, or my husband needs XYZ. I'm like going through that. So I am so fed up with emails, phone calls. Nar, I need to reschedule. I need to cancel my appointment. And then we have like the podcast coming up. And I'm like, fuck, I need to read what we're going to talk about. And like, what are my talking points? Like, what am I going to do? In the meantime, I'm like, but why do I have a UTI, you guys? Like, I don't understand. Like, that's happening. So it's like your body is starting to break down. And I'm like, well, maybe I need to drink water. But I'm like, shit, I actually need more coffee because I'm going to fall asleep on myself like right now. So Corry, there's so much going on with life. I don't even know how to like compartmentalize my thoughts. So I have 1,000 lists, as we always talk about my lists. I've had 4 UTIs in the last 2 months. And I'm like, what is happening? Like, I know I'm very clean. Prior to having intercourse, after intercourse, we do our thing. We keep it like as clean as we can down there. Like, I know the female anatomy pretty well. So I know what's happening with it. So I'm like, what the fuck is happening? And mind you, I had to do like this telehealth thing. And then the doctor that happens to be on is an Armenian man. And I'm Armenian. So sex in our culture is not really talked about so freely, let alone on a fucking podcast. Okay. So here I am. And the minute I see his last name, I'm like, fuck my life. I can't believe he's Armenian right now. And I'm about to tell him that I just had sex with my husband, which is a normal thing, right? But I'm like, God damn it. I'm sitting in there talking to him about how I just had sex and I have a fucking UTI again. It's like the fourth one. And then I start Googling. I asked Dr. Google, what is happening? And apparently when you're dry and the friction will cause you, other than water, right, which I suck at drinking water, but it'll cause you to have a UTI. So here I am. You guys, I texted Corry. I'm like, what is this lube thing that we talked about, I think on one of the episodes? What supplements do I need to take? What do I have to do? So she tells me this one supplement. She sends me the link. Here I am looking it up. What's it called again?
Saw Palmetto.
Yeah, that thing. But the minute I read, basically, if you're not trying to have more kids, don't take this.
Be careful when you start taking this.
And then you texted me, Nar, if you're not trying to have any more children, just be careful. Like, I'm like, there's no way I'm going to take this medication or this supplement to get my ovaries up and running because I'm not trying to have another one. So then I'm like, all right. So I looked and looked and looked and I asked our friend AI, what's the best lube out there? And it gave me a couple of recommendations. I ended up just getting one in the mail. What I'm very, very excited about.
Well, and I think too, so that women know, in their 40s here too, that's very common when your estrogen and progesterone start to change just a little bit.
God.
Which is the sad thing, is most women, and see, this is where I think it's just brilliant and divine design that, you are 43?
40, yeah.
43. So, and I just turned 48. So like almost like 4 years difference. But when I'm looking at this was one of those things that I think women come into and you don't understand. Like your cycles are still normal. You've got really little kids. So it doesn't make sense. And then all of a sudden things like this start to change. And you're like, what is going on?
Oh, yeah.
And it's classic perimenopause symptom is that basically there are women that they talk about. So that was something I never had. I never had like the paper thin skin. That's common. A lot of people have the paper thin skin to the point where in group exercise classes, people would talk about it like with the spin bikes and how they couldn't even ride the spin bikes because it was so paper thin.
Really?
And so what happens is when you're having sex, you can have like itty bitty microscopic tears.
Yes, I read that.
And then
yes.
that is, it doesn't matter. It can get sexual body fluids, whatever, get up in there. And then that causes the UTI.
There you go.
So you can always ask too, once you feel comfortable with your OBGYN, like the next visit that they do, you could ask them about it too, because they can give you a topical estrogen to put down there. And basically, instead of just a lube, the topical estrogen, because as we go into perimenopause and we lose the estrogen down there, it's full of estrogen. So that keeps everything. Basically, if you think about, I'll just go way TMI, and this will just take this nice change in topic. But the vaginal canal and all the tissue down there is really elasticy. And I kind of mentioned this when I was talking about how when we first started talking about this. But so that elasticity and all that, if you think about it, it's just way TMI. But if you were to put your fingers up there, it's really soft and you can feel that elasticity. Well, when you hit perimenopause, that totally goes away.
Yeah.
And so it's definitely rigid. And they say, and the reason why sex can be painful is because the vaginal canal can actually shrink. And so it becomes smaller. So it can be, you can have been married to your husband for all this time and we've been having sex for 10 years and it's never been a problem. And now all of a sudden it's a problem.
Yeah.
But the good thing about vaginal estrogen down there is it doesn't go systemically. So it's not going through your body. So it's not like you're taking extra estrogen, but it's something that some women can do because it just makes things better.
And to piggyback off of that, So I was talking to a girlfriend and she said, Nar, I'm prone to having UTIs all the time. And then another girlfriend said, if I eat a lot of cheese, I'm prone to having a lot of UTIs, which I don't really understand the connection of the two. But I found, so mind you, I'm talking about number 4 in the last 2 months. And I think the first, second, and third UTI, I was prescribed antibiotics. This 4th time, I'm like, I'm not taking any more antibiotics. Like, how much antibiotic can you take? It's like, I'm done with it. I found it on Amazon. It's called UT Answers. You guys, it's phenomenal. I have not taken one pill of antibiotic or with this last episode of a UTI. And you can't overdose on it. So I take 4 at a time. And it says like the first day you're going to take 12 capsules. I know it's a lot, but it's just like herbal. And then the second day you take, I don't know, however many, the third one. And then by the 3rd day, you're done with it. So it's helping me so much. You know, that urgency, frequency, all of it is gone because of this UT Answers.
Oh, I went away for my birthday this weekend and I was with a girlfriend and her friend is, they're all turning 55, but her friend is getting, married after being years of being single. And they were talking about red light therapy, right?
Yeah.
And so it was so funny because she brings out her red light mask and she's like, here, you can just lay down for 3 minutes and you can put this red light mask on. And I was like, oh, how much is this? I'm like, oh yeah, this is the real thing because it's like way expensive. And she's like, you do know that they make red light vibrators and dildos now, right? And I was like, oh my gosh. I said, of course they do. Of course they do.
No.
Because, and I can't even think of it.
I haven't heard of that.
I can't even think of it. There is a process where there are doctors that will do, OBGYNs that will actually do, it's like a laser treatment that goes up inside your vagina and it's supposed to help with the elasticity.
Right.
I can't remember what it's called, but there's...
I don't know what it's called, but I know of it.
I'm going to say a good friend of mine, because she's going to kill me. She's like, you cannot out me. But she ended up going through some of that stuff because she was having really, really bad UTIs as well. Same thing. And she was the same thing. She was like, I have one partner and, it's not
anything to do with the cleanliness of it. It's just, it's such a short urethra that it just like travels up there. Like the smallest bacteria can go up there. And you're like, great. Now here we are again with another UTI.
Hers was, she was menopausal and she had gone to her doctor and her doctor was like, you need to get off estrogen because she's older. Like she's been in menopause and been on estrogen for a long time. So they're like, oh, over your 60s, you should definitely get off of it. And so I was actually talking about it. I said, I don't think you should do that. I said, go look about it. And she was like, the hot flashes came back, all this. And I said, well, of course they did because you're withdrawing off of estrogen. It doesn't matter. So people post-menopause that then go on hormone replacement therapy and then they're like, why all of a sudden did I get all the symptoms again? I'm like, well, because you were on estrogen and you took it away. So of course you're going to get those symptoms. But she didn't understand. And I was like, go back to your doctor and say, you could do it. And then we were talking about it a little bit later. And I said, she kept complaining about her sleep. And I said, well, why don't you go on progesterone? And she said, well, I don't have a uterus, so I don't need progesterone. I said, that is one of the biggest, I think, misconceptions, mistakes that a lot of women are saying is that if you've had a hysterectomy, they mainly say the only reason why they give you progesterone is to prevent growth because estrogen is a growth hormone. Think about how high your estrogen is when you're pregnant. So women that have had a hysterectomy, they don't necessarily need to have the progesterone. But I said, but what you don't understand is it's such a calming hormone. I said, if you're not sleeping, you need to be sleeping. And so then we were all sitting around and we were having this conversation and she was telling me, she's like, she's sleeping like a baby and everything. And my husband's like, where did you get that advice? And she goes, her? Your wife? She told me that I needed to change this.
I don't understand where the disconnect is between patient and doctor. Why aren't the doctors telling us this stuff? You know what I mean? Like, how does she not know about it? The doctors are supposed to be, if you're doing this for a living, you need to be able to talk to your patients about it.
Except for that's why now, if you look at it, there's all these, if you look up most of the menopause certified practitioners, you have to pay out of pocket to go see them because they're not covered by insurance. And so you have to go pay a fee to see all these women.
Yeah. Well, that's bullshit.
I think there's going to be a lot of change. I think we're going to see the medical doctors coming out of and doing more stuff with this and understanding if women are going through menopause between the ages of 40 and 55 and yet we're expected to live to our 90s, that's a whole lot of life left.
Yep.
This is something we do care about. We're 100%. Talking about we do not care.
Tell me about these. What is happening here? What are we doing? Why do we have glasses on the table?
Readers, unfortunately. Readers as we get older. So my kids have gone and gotten their prescriptions right. And so I kind of started with, I was looking at my phone and I was sitting there and I went like this. And my mom goes, you need glasses. I was like, no, I'm fine. I'm fine. And so I started looking at it and I was like, okay. And then I had gone out to Virginia and I was visiting Stacia and we were working on our computer stuff and I kept doing the same thing. And she like hands me a pair of glasses. She's like, just try these. And I put them on. I was like, oh my gosh.
Have you seen? Sorry, go ahead.
No.
Finish your thought.
Well, I was just going to say, because by the end of the day, it was like I couldn't look at like the phone or anything because my eyes were so blurry. And I'm like, what is going on?
So I've seen this reel on Instagram. A group of girls go out and now they have like those little lights that the ones that you tap on the table. And then it's just like a little light for the table as you're dining. Everyone has their phones out in addition to that little lamp with their phone light on and looking at the menu. I'm like, how old are we? Like we're acting like we're 60-year-old, but
yeah,
the women out there. But no, you guys, your eyesight just plummets after a certain point. I don't know if it's menopause. Listen, I feel like after I had Mateo, I died internally. Like everything starts to fall apart, right? Your bone, like you're just achy and the energy and my eyesight is probably the biggest thing. I lost it. I can't see shit. I walk around, everything looks hazy to me.
Do you have glasses?
No, but I did go to the optometrist.
But if I put these on, then it's like, oh my gosh, I can see everything. But I went in and they were looking at it. And after I'd seen Stacia's, they were like the little bifocals. And I was like, my husband's like, please, you can't wear those. I was like, okay. So I went to the doctor and I was looking and I said, I think my eyes have probably had a good run. And she said, yep, you're right.
Yeah.
But now at the end of the day, my eyes don't hurt. So I'm realizing, I wonder how long do we spend in that in between, right? Where we're massive headaches and my eyes were itching. And I was like, I really should go look. And now my eyes don't hurt. Okay, so let's talk about humor for a second.
Okay.
Why? So does it resonate with you, the humor that you see about us getting old and stuff online, or yes or no?
Not there yet because I'm not fully in it yet. I'm like the baby of the perimenopause. Like I'm just starting to see the symptoms. Part of me is in denial. Like, no, this is normal. I'm just adapting, right? Like I always do. And I'm not there yet. But let's say the humor in childcare, home chores, running a business, I could relate to. And I think it's freaking hilarious. But the menopause, I'm like, I'm not there. I'm not there mentally.
It scares the shit out of you.
It does scare the crap out of me because I'm like, I don't want to go through this shit. How come guys don't go through this fucking thing?
There's a lot that talks. I went to a conference with our good friend Jen, and the lady that was putting it on, her husband is like a board certified doctor and all this kind of stuff. And he was talking about how it's called andropause, and it's when men start to lose their testosterone and the testosterone goes down. And then I was talking to one of my best friends, and we were away this weekend and we were talking about it. And she was talking about the need for her husband to get on testosterone. But she was saying, she's like, I'm really worried about my husband getting on testosterone because I don't want him to be more angry,
raging. I was just gonna say,
stuff.
yeah.
And I looked at her, I said, did you know that it's actually a symptom that when men are, and so this is just, an educational moment for women. If your husband's partner, spouse, whatever, has low estrogen, they can actually be more irrational, more anger, more frustration for men. Because if you think about it, just think about women for a second. When our estrogen starts to change, even like when your husband says, I can see it in your eyes, like it's coming, right? There's that fluctuation. And whether the estrogen is high or low, like, it's the same thing, right?
Yeah,
women just tend to be like bitchy and irritable. Well, it's the same thing with men. If you look at if their testosterone is too low,
they too can be bitchy.
They can be the same way. And so they can have issues. But a lot of women are thinking, I don't want you to get on testosterone because people associate too high of testosterone with you're going to be a bear to deal with.
Yeah. Okay, well, men can be bitchy and
I don't know. I feel like men go through a lot of midlife stresses and stuff. I feel like my husband kind of went through that a couple of years ago. And sometimes now it does. My kids will ask like if dad's in a bad mood or whatever. And I said, a lot of times it's just because of the fact of his work and what he does, and there's lots of things, and it's just that stress.
Yeah.
I think when men are always traditionally seen as the breadwinner and they have to provide for the family and do all these things. And so I think a lot of those stresses are there. And then as society changes and norms change and things are different, I think men feel the brunt of some of it in terms of how they're.
So what are we women supposed to do? Like, I feel like we're literally, we're amazing people, you guys. I don't know what anyone says. I mean, we are also stressed and we work, and even if you don't work, you're home with the kids, and even if you don't have kids, you're still doing something. Like, it's everything. I feel like we do everything.
I got to tell you this funny story. So I got in a lot of trouble this weekend.
Why?
I decided to repost. Like, I reshared somebody's Instagram post, right?
Oh, God.
And it was of this woman. So all I get is, I get a text from my husband. You need to take down the post you just put on Instagram. Why? Because our youngest daughter's friend said, have you seen your mom's Instagram and what's on her Instagram? And I was like, really? Really? You got to be kidding me. And so I was with a good friend of mine. I was like, I don't understand this, whatever. And she's like, your kids need to understand that your demographic is like women that are over 40 and perimenopause.
Do you follow your kids on Instagram?
Oh, yes. Oh, yes.
Do they follow you?
Yes.
Do you think they should not?
Well, so this is the thing. When my kids tell their friends, oh, my mom has a podcast, my mom has a book, my mom has this many followers on Instagram, they decide to follow me. And I'm like, maybe you shouldn't get your friends to follow me. So, but I have to share because I took it down because everybody was like, it needs to come down, it needs to come down. But I was dying laughing. So it's this wife and she is in the pantry, right? And she's looking in the pantry and she's going like this and she's like, turns around and goes, honey, I can't find any protein. I don't know what to have for protein. And then the clip goes to an elephant, right? And he's swinging around his trunk going, I got some protein for you, honey.
Oh,
and I was just, when I saw it, I was dying laughing, right? So it's really the reference of sex. And I'm sitting there going, and I was like, well, how are you going to explain this to your girls? Like, do you want to explain this to your youngest daughter about what this is? And I'm like, yeah, I'll explain it to her. I've been married for 25 years old. Like,
yeah,
semen has protein in it. Like, yeah, there you go.
Oh my God.
But I was like, so who was it that said anything to you? And she's like, oh, it was one of my friends that's a boy commented on it. I was like, oh my gosh.
God. And so you took it down.
So I took it down.
But did you get slack from the person that was like, honey, where's the protein? Woman?
No, because it was just a remix that I had found. I tend to find like the best remixes online and share them because, again, I find for me, if I can see stuff that there's humor.
Yeah.
Like my most viral post is of a lady that she's like holding her phone and she's talking to her friend going, yeah, well, I got to find my phone. I don't know where my phone is. And she's looking through her bag and she's like, if I had my phone, I could look in my bag to see. But the whole time she's talking.
On the phone.
And then the friend goes, okay, well, call me back when you find it. And she says, okay, right? And it's because I sit there and go, that's me.
That's so true.
That is me. And so this book is on the New York Times bestseller. It's number 2 on the New York Times bestseller. The only other book in front of it is Mel Robbins' Let Them book. This to me says that women are like, we're fed up, we're annoyed, we want people to understand that this is something that's like real. Like, I think because the hardest thing is so many people are like, this is made up in our heads and we don't really go through this. But I don't think people understand how powerful hormones are. When I look at, people, and I wrote down some of them like Halle Berry, Ashley Judd, Shonda Rhimes, Drew Barrymore, Kristen Bell. These are like celebrities that are supporting this book. But they're all women that we know of that are all going through perimenopause. So they're making it relatable for the rest of the women in the world to see. But I kind of really resonate with.
I always trip out on things like that. Like, why do we give celebrities so much credit? Like, who the fuck cares, let's just say, if Kim K or Kristen Bell likes a book? I don't give a fuck. The only thing you do for a living is you're an actor. That's all. That's what you do for, it doesn't make you God. Yeah. It doesn't make you any superior than I am. It's like, I'm an aesthetics nurse and you're an actor. Fantastic. You have fame. I understand that. But then part of me is like, well, if let's say Kristen Bell has the money and the resources, but she still going through this just like the average Joe, then we should probably listen to her too. Like, it's okay. Because if she's going through it, it's okay that I'm going through it. Like, I don't get starstruck. Like, you know, people will freak out if they see someone who's a little bit famous at a bar or something. I don't freak out. I'm like, all right, that's cool.
See, I wouldn't even know who the people are. So you and I would be going and sitting there and you wouldn't care who the person is. And I'd be like, I don't even know who the person is. And there would be other people. I had a client once and she was a nurse that worked at up in LA, and she was like saw all of the celebrities come in, and she would see all of them come in, and she would say stuff about people, and I'd be like, I have no idea. She would tell me more stories about like the dumb things that kids do, or she was talking about somebody that was on a bike and just stupid things that they did and basically like lost their entire butt. Like, she was telling me these stories, and she's like, I could tell you who these people are and you wouldn't even know who they are, wouldn't you? And I was like, yep.
So on my Instagram, I have like these little clips of, let's say, if Jennifer Aniston was my patient, what I would do differently. What's the Bezos' name? Anyway, Miss Sanchez. So I have one where if she were to come into the med spa, what would I do differently on her? Because she's very overfilled and overly done for my taste. But if she were to really come to me, would I actually freak out like, holy shit, she's actually here. What am I going to do on her? Or would I just take it like, all right, cool. You know how many times I've had someone come to me and say, I want this done, that done. And I'm like, absolutely not. I'm not filling your face up with even more than what you really need. Let's dissolve. Let's go backwards.
Is that possible?
Yeah.
Oh, that's good to know.
Yeah.
Okay. One thing that I was going to leave us with as we finish this off. So instead of our, Q&A of these things, I thought I would just share kind of from MIDI Health, the stages of menopause, so that people kind of understand what they are, because we've hinted at a little bit and where we're at. But so perimenopause often begins in the mid-40s. So that's why it's really relevant to every that we're saying. Lasts on average, they say about 4 years. You're still having periods. They may be irregular, longer, shorter, heavier, lighter. You may also begin to notice hot flashes, insomnia, brain fog, the very fabulous weight gain, hair loss, anxiety, all the good stuff.
Yeah.
So then this is where the one thing that most people get is they'll say, I'm in menopause. Menopause is one day on the calendar. So menopause is the day when you have gone 365 days with no period. That right there marks menopause. Everything past that is postmenopause. But a couple other little ones, just so that you guys know, so that you're not losing your mind. I remember one of the symptoms I had was the memory loss. And we kind of mentioned that a little bit.
The brain fog,
I literally thought it was like early onset of dementia.
Yeah.
So a couple of these. So hot flashes and night sweats are common, insomnia, but a couple of other things. There's the forgetfulness, cognitive issues, but other things that a lot of people don't necessarily think about, anxiety or depression, that's a big one. Panic attacks are a big one. The vaginal dryness, painful sex, difficulty achieving orgasm. Again, I was like, I don't know what's happened. Why is my body? It's like, nothing. I was like, nothing feels good. I don't understand. Joint or muscle pain, hair or skin changes, urinary urgency, incontinence, reoccurring urinary tract infections right there.
I should put my name next to that.
Dry mouth, body odor changes. The big one is women will start complaining about like all of a sudden they smell like onions, like their armpit sweat smells like onions. And that is hormones changing. But headaches, migraines, breast soreness, unusual itchiness. That's another one that most people don't understand. Numbness or pins and needles sensation in the loss in your lower extremities. Loss of bone density, obviously. Increased tooth sensitivity, or all of a sudden if you end up with like gum disease or cavities and you've never had those before. Burning mouth syndrome, digestive issues, bloating, brittle nails, irregular heartbeat, new onset of allergies or asthma. So you can have one or two of these and not have any of the others. And there's some women that will just breeze right through the whole entire thing.
Yes, that is not me.
But that's okay. We're going to be here for all of it.
Yay, go.
Okay, with that, that's the end.
Good talking to you.
Yes. We love you, women.
Okay.